Infertility touches both the body and the heart. A quiet moment by a window becomes a place of questions, of hope, and of courage. Medically, infertility is the inability to conceive after 12 months of regular, unprotected sex, or after 6 months if age is over 35. Behind the definition is a living system: uterus, fallopian tubes, and ovaries working together to create the chance for life. For some, pregnancy has never happened. Primary infertility, with ovaries that may function yet no conception. For others, a pregnancy occurred in the past but will not come again. Secondary infertility, a reminder of what once was and what is still desired. Ovulation can be irregular or absent, as in polycystic ovary syndrome, where many small follicles stall and a mature egg does not release. Sometimes the pathway itself is blocked. A fallopian tube sealed by past infection, inflammation, or scarring, so sperm cannot reach the egg. Inside the uterus, growths can interfere. Fibroids in the muscle wall or small polyps in the cavity can disturb implantation. Endometriosis places tissue like the uterine lining outside the uterus on ovaries and tubes, causing inflammation and scarring that make conception harder. Time also matters. With age, the number of eggs declines and their quality changes. Possibilities narrow even when the will remains strong. Answers are not always clear. Tests may return normal, and the name becomes unexplained infertility, a diagnosis that describes uncertainty rather than cause. Families turn to faith as well as medicine. Women gather in prayer, seeking comfort, strength, and hope together. Evaluation continues with ultrasound scans that map the uterus and ovaries, and carefully timed tests that follow follicles. In the laboratory, embryos are watched under microscopes, culture dishes warmed, and tiny cells counted, each step designed to turn uncertainty into information. Treatment often begins with medicines that stimulate or regulate ovulation, tablets and hormone, injections that encourage an egg to mature and release. When structure stands in the way, surgery can help. Fibroids removed, polyps cleared, scar tissue treated so the uterine cavity can welcome an embryo. Alongside procedures, daily choices support fertility: nourishing food, steady movement, healthy weight, restful sleep, and stress reduction through meditation or quiet reflection. Some families try intrauterine insemination, placing washed sperm into the uterus at the right moment, closer to the waiting egg. Others choose in vitro fertilization, eggs retrieved, sperm introduced in the lab, and a developing embryo gently transferred into the uterus. Science meets tenderness as technology creates another path toward pregnancy. The journey carries long nights. Tears come, then dry. Partners hold each other, sometimes in silence, sometimes with plans, and decide together what to try next. Then comes a new beginning. A positive pregnancy test held with trembling hands, joy breaking through after years of waiting. A belly that grows rounder month by month. Checkups at the hospital, nurses and doctors guiding each stage. A husband smiling beside his wife as they meet the doctor, both filled with anticipation. The waiting before labor, the strain of contractions, the husband's hand in hers as pain and hope mix together. And finally, the reward: a first cry, a newborn wrapped in soft cloth, and the gaze of parents who have waited a very long time. Infertility is not a single story and not a single outcome. It is medicine and emotion, science and spirit, limits and possibilities. And within it all, there remains a steady truth. Even when the path is difficult, there are ways forward.